There's a nearly $10,000 mistake that you can make when choosing a Medicare plan. And to make things worse, a lot of agents aren't going to tell you about it. Sometimes they leave out key details when talking about certain plans because the plan that can cause this $10,000 mistake, it's usually the plan that pays the highest commissions. And that mistake is starting with a Plan G when it's not actually the right fit or the right time for you. Plan G is very popular, and some people even call it the gold standard, right, of Medicare plans. It can be a great fit for some people, but for others, especially those with tighter budgets, it can add up to thousands of dollars of avoidable premiums. So first, let's go through the Plan G. Plan G is popular because it's really easy to understand, it covers a lot, and it feels really predictable. It almost always is the first thing that you hear about when you start looking for Medicare Supplement options. And believe me, you're not imagining it. You really do hear a lot about it everywhere. You'll hear about it here on YouTube. Your neighbors may be talking about it. It's very popular, but even though it's popular, it doesn't always mean that it's the right choice for everyone. Now, one reason why people talk a lot about Plan G is the price. Most people only hear about the monthly amount, and maybe it's $150 or $200 a month in your area when you're turning 65. But what they don't hear about is how that number changes over time. Plan G premiums are not locked in for life. It's not like you start at $150 and you keep paying that. They go up every year. They are typically twice a year increases, once for your age and once for inflation. And those increases are not random. They're built into how the plan is priced from day one. Most companies use something called attained age pricing. Attained age means it's based on the age that you have reached or attained. That means that your premium automatically goes up as you get older. And on top of that, you can also have it go up because of increases in medical costs and inflation and how many claims that the company had to pay out. So you need to expect that a Plan G will increase every single year. Now here's how it can look. Maybe you start at $150 a month and you have a 10% increase with the Plan G every year. That's what we've been seeing in the most recent years. And that money might have to come out of your grocery budget. It might have to come out of your travel fund. It might have to come out of your savings, right? It depends on how much money you have in retirement. And so many people are living on fixed incomes. Now, if you can't afford it later, then you can switch to a different Medicare supplement, but that might be complicated. With Medicare supplement plans, your health history might matter if you want to change coverage after you've already passed through the initial enrollment period. That's why some people look at Medicare Advantage from the very beginning. And other people look into it later when a supplement premiums start to stretch their budget. But Medicare Advantage, in some cases, has a reputation problem. And part of the reputation problem is that you hear more about the Plan G. And the reason for that, honestly, is commissions. Agents get paid differently for Medicare supplement plans than they do for Medicare Advantage plans. And the difference oftentimes influences the plans that get more attention and the plans that you're being told about. Now, it doesn't mean that one plan is better or worse than another plan, but it does mean that you should see both sides side by side, and you should understand both sides, meaning Medicare Advantage and Medicare Supplement, before you make a decision. And when you look at Medicare Advantage on its own, you'll notice some things that are familiar. If you've had insurance through a job or a union or the ACA marketplace, then you've already worked with networks, co-pays, and different rules that plans have about like prior authorization. It's not a brand new system. It's just Medicare's version of something that you're already used to. So it's just like your work insurance. Medicare Advantage plans have contracts with networks of doctors and hospitals. And if you stayed in a network before, it would be exactly the same way here when you're on Medicare. If you had a copay to go to a specialist before, then you'll probably have one here too. And just like the old plan that had caps on how much money you were going to spend every year, well, the same thing is going to happen with a Medicare Advantage plan. So a lot of people are familiar with this and they expect their insurance to be like this. And so Medicare Advantage is comfortable for them. One of the things that gets a lot of attention in Medicare Advantage plans is prior authorization. And people think that prior authorization is just a Medicare Advantage thing, but it's not. Prior authorization is the same thing that you had on your group coverage, the same thing that you had on your ACA coverage. People make it sound very scary, like the plan is not going to allow you to have a knee surgery when you need it, when you're having issues with your knees, right? Or machinery because you've got lung problems, whatever it is. They make it sound like prior authorization is going to prevent you from getting the care that you need. But what is prior authorization? It's simply that your insurance company is saying, before we cover this, we want to make sure that it's the right treatment at the right cost. And if you've ever had a doctor's office do a pre-approval for your insurance before scheduling a procedure, it's the same thing. Most of the time, your doctor office handles the paperwork and you don't have to do anything or even notice that it's happening. And a good doctor's office will handle it well, and you won't have any issues, and you usually will be able to go right through and have your procedure. And that's really the way it's supposed to work. It's supposed to happen behind the scenes between your doctor and between the health plan. Now, once in a while, there's an issue. We found, according to the Kaiser Family Foundation, which is a nonprofit that studies Medicare, Medicare Advantage, etc., they have found that 83% of the time prior authorizations are approved immediately, no issue. Of the 17% that aren't approved, sometimes they need to go through an additional process. But after those go through the process, then 90% of those are approved. So the vast majority of prior authorizations are approved. When a prior authorization is not approved, it's usually the fault of the doctor's office not submitting the proper paperwork. And I say the fault. There's a lot happening in a doctor's office, right? Like, I'll give them some grace, right? There's so much happening. They have so many different insurance companies they need to respond to. And so they may not have known exactly what needed to be submitted. And then you received something in the mail that said your prior authorization was denied or pending, needing additional information. And so we see that happen, and that frustrates people. The same thing, of course, exists in all versions of HMO and Medicare Advantage, the Affordable Care Act coverage, as well as group coverage. They all have this same structure. And why? The reason is pretty straightforward. It is to prevent fraud and abuse. There is fraud and abuse through providers meaning doctors' offices, hospitals, etc. In fact, recently, the government caught a fraud ring that had taken billions of dollars from Medicare using schemes, right? So it's to stop fraud. In addition, it's to stop abuse. Oftentimes, there are people who abuse the system. They run to the emergency room when they really could have just gone to the urgent care, right? So it also is to slow abuse, and that's a good thing, because it saves cost for everyone and it makes it affordable for everyone. Even original Medicare is starting to have some prior authorizations. Now, it's not a good thing when it prevents someone who actually needs care from receiving care, right? So there are times when there have been situations, and that's why you need to have an insurance agent like us who can help you through those, who can work with the insurance company, who can work with Medicare, who can operate on your behalf to make sure that you get the procedure if there is one of those issues. But they're so far and few between, literally less than 1%. And you could look and say, well, you know what, out of 100 situations, there's probably something out of that 100 that needed some additional questions or maybe should have been reconsidered, right? So it's not a terrible thing. So now you know the networks, just like the plan you had before you run Medicare, have prior authorizations, and it's not some new, evil corporate trick. It's just a cost-containing and protection mechanism. And when you take away all those big, scary things, it's easy to see why starting with Medicare Advantage can actually make a lot of sense for a lot of people. And here's where the 5-figure mistake happens. People start with the Medicare Supplement Plan G when they first turn 65 because it's predictable, it sounds like it's the best, it's the gold standard, whatever. But over time, the premiums go up, and then it gets too expensive, and then they end up switching to Medicare Advantage later anyway, which is a plan that you could have started with and saved all that money from the beginning. So that's years of higher premiums that you didn't have to pay. And for many people, that easily adds up to $10,000 or more. They start with the supplement, they realize over time it becomes too expensive, and they switch to Medicare Advantage. But when they joined a supplement, they were 65. They were in good health in retirement, and they didn't actually need it until they were 75. So they paid for it for 10 years and then switched to Medicare Advantage anyway. So it's really important to understand Medicare Advantage and a Medicare supplement and understand the long game. How much is a supplement going to cost in the long run so that you don't end up paying premiums for something that you don't use and you switch to Medicare Advantage later. So if your budget is tight and you're just affording the Medicare supplement now, and you can see and understand that it's going to get more expensive over time, Medicare Advantage might be a smarter starting point. The key is this: don't let the popularity of the Supplement Plan G or an agent trying to make commissions make the choice for you. Run the numbers for you, for your budget, for your long-term budget, and for your situation. Then look at both options side by side, and then choose the plan that protects both your health and your wallet for the long term, not just the immediate term. And if you're still on the fence, maybe you can afford the Plan G right now, but you know that those premiums will be hard later, then check out my next video. We put the Medicare Advantage and the supplement side by side, comparing real 5-year costs to help you see which one is the right fit for you.